Welcome to this really special episode of Voices of Care here from Birmingham's NEC and the Care Show 2024. The theme is collaboration in social care, and we've got some fabulous guests. Skills for Care, Homecare Association, National Care Forum. We're talking about inclusion in social care for the workforce, the importance of clinical excellence and empathy. So please join us for what I'm sure is going to be a fabulously insightful episode and speaking to some great leaders at a transformational time for social care. Now, I hadn't actually predicted that, having met you, I think, over the summer, that this conversation might be, well, how's your summer been? And all fairly easy going, but I think it's been extraordinarily busy.
There's not been any easy going side of it. Yeah.
Can we just start with Darcy first? Because obviously it's a seminal report. I know it's about the NHS and that was the remit. But a couple of interesting things that were definitely brought out, which are related to social care.
Yeah, I mean, I think that it's very helpful always when these reports make reference to the fact that you cannot address all the challenges within health without addressing the challenges within social care. So those are useful things, and we had the COVID inquiry talking about the same thing, a report on Module 1. I guess the challenge with all of this is to continue, for us all as the sector, to continue to recognise that social care is there as a service in its own right. And helpful as Darcy is, if that becomes the locus of attention of how to address the challenges facing social care, there'll be a whole host of people who miss out in relation to any reform tied around that, as well as a whole host of services and models of delivery.
Well, that advocacy for the whole sector, I guess I should actually belatedly congratulate you for taking the role at the Care Provider Alliance.
Yes, indeed,
so that's the voice.
Yes.
You've got a busy 12 months ahead. With that.
A busy 12 months ahead, yes.
Now, you'll be aware that Oxford University's Department of Social Policy have published a report literally days ago. And I bring it up because, of course, the National Care Forum represents not-for-profit sector.
Yes.
And just wanted your opinion on that, because my reading of that, I think the opinion is that there's been a huge amount of outsourcing, predominantly to the for-profit in residential care, I'm talking about, as well as children's services. But the finding was that there's a paradox at the heart of social care relating to the fact that public and third sector, that's the phrase they use, providers outscore on quality measures. Just want to get your views.
I think these are it's an interesting report and something I need to spend more time looking at the detail of, because it only came out, as you say, the other day. I mean, I think what I'm interested in, I guess, is where the government takes its kind of commitments around the National Care Service.
Yeah.
Pre-election, it talked quite explicitly about the notion of creating a framework which would have sort of public service ethos at its heart, and I guess the reports that separate out different types of provision will be important in terms of helping them think through some of what that framework might look like.
Let's wait and see what that looks like, as you say.
I think with any change, if there is going to be a change around the way that care is delivered, and this goes for whether we're talking about fair pay agreements, or whether we're talking about the National Care Service, or whether we're talking about for-profit versus not-for-profit provision, then there has to be a reasonable time frame and plan so that the sector can adjust and change, and that we can really ensure that we have a continuity of care and a sustainability agenda that sits behind it. So I think I'm not for any kind of rapid shock treatment, but I think it's definitely about working through more quickly than is currently indicated some ideas of what the future framework might look like, so that people can plan their provision accordingly.
And that will also be important in terms of the regulatory framework. I'm bound to reference, of course, the CQC, its well-trailed challenges, and we have a new CEO appointed, Sir Julian Hartley, so I think you welcome that appointment, but there's a lot for them to do in terms of winning trust, I guess.
Absolutely. I mean, I think I can talk about this with sort of those two hats on. So from the CPA perspective, the CPA is leading a review of the SAF, trying to get really into the detail of providers' perspectives on the single assessment framework. And I think that's really important, because the work that's happened to date hasn't had that granularity or that direct feedback from people on the front line, those who've been through an inspection under the single assessment framework and those who've been preparing for it. So I'm really pleased that we'll have an opportunity to give voice to social care. And I think in the context of the new appointment of a chief exec, I think the opportunity to be able to deliver some really clear messages from social care about what it wants about the future of regulation, that's going to be vital. And I'm confident that Sir Julian Hartley will take on the role, recognising the full breadth of the services that the CQC has to interact with, and actually, understanding that he's come from a background, not just his most recent background, but prior to that, working within a sort of health and care community in Leeds, which actually has a very strong reputation around the integration of health and care. So that gives me some confidence.
Absolutely, and you've been very busy on the party conference circuit, etc., and with the budget upon us and the review. I just wanted to get your perspective on that. There's been County Council Network report showing a £54 billion hole in the next 5 years. So we're in very constrained circumstances. So, what are you looking for in terms of the government? One or two key things, because you've been advocating, as has the whole sector, very strongly for some immediate action.
I think there is an absolute drive around sustainability. So, we have to have some confidence that the level of funding that is going to be provided it will cover off costs. So the market sustainability funding information came out at the beginning of this week, and what that showed was that across the board, the average uplifts for care providers had been around somewhere, depending on which type of service, somewhere between 6 and 7%. Well, we know that national minimum wage went up by 9.8% or whatever it was this year. So actually the maths doesn't work. So if we continue to go forward in that vein, then we're going to really hit a crisis. Now, I think what we're looking for is some commitments around sustainability, so that the things that providers need to do in order to be good employers, in order to deliver quality services, are possible and funded. So that's an immediate thing. And then really to try and rapidly set out what the framework is for the future, so that people can make investments that make sense. We've got a lot of people here today who will be being courted by tech companies and those who have got some fantastic offers, what the future looks like. I also chair the Global Aging Network, so I'm looking all the time across the world about the really exciting things that are happening in other countries around care. That should be what we're aiming for.
But we need the stability to do that.
We need the stability right now in this budget, but we need that spending review to be hugely ambitious for social care.
Absolutely. One final question, if I may, and forgive me if I don't mean to offend, but the acronym WAG is not something I normally associate with you, but I believe you're attending a dinner dialogue with WAG, meaning women who have achieved greatness in social care. You've received an OBE for all the things you've done. I just want to spend 2 seconds on some of your inspirations and your motivations for what you do.
I think that I am absolutely committed to the notion of social justice, and lots of people will say that, and I suppose I feel I'm trying to live that. I've spent all my life working in the not-for-profit sector, all my life working in housing, primarily in housing care, advocacy, support work. I think that this is the most exciting part of the world to be involved in. Every day people are transforming lives. Every day is different, to use some of the old analogies, but we can absolutely create a future that is much more positive, much more inclusive for people, and that's always my commitment. And actually the WAGs, the Women Achieving Greatness, that's fantastic, because we are a sector that's dominated by women. We have got some amazing women who are out there just doing the do each and every day, and hats off to them. I think they're incredible.
Absolutely. As someone personally who's been involved in the sector for over 20 years, it's been richer for your advocacy, if I may say so. Thank you very much for your time today, and I'll look forward to seeing you around the care show over the next couple of days.
Brilliant. Thank you.
Thank you, Vic. Jane, welcome back to Voices of Care.
Great to see you, Sahel.
As always, lovely to see you. It's only been a few weeks, seems only a few weeks. I was at the beginning of the summer, and I thought it's going to be a fairly gentle conversation, not much happening, completely the opposite. I guess we should start, or maybe we should start, with the Darcy report. Now, I'm obviously very focused on the NHS, but I think there's things that you've spoken about that are pertinent to home care and social care generally.
Yes, last year, as you know, I was chair of the Care Provider Alliance, and in that role I was invited to be part of the expert reference group for the Darcy review. which was good. So they tried to be inclusive, and our views were sought, which we did contribute. And Lord Darcy knows, as an NHS professional himself, that you need social care to work, but his remit was quite tight. I think many people would say that there wasn't anything surprising in his review. He just very crisply analysed the situation, probably more starkly than has been done in the past, because more things have gone wrong with years of underinvestment. And I think the message that the NHS is broken but not beaten is fair, but I think the broken message is demotivating NHS teams. So, the government has to balance hope and optimism with realism.
Absolutely. I think one of the other things you've been doing, which you've been very busy attending the party conferences, we're getting a little bit more detail, dare I say, around the government's plans for social care. I know you're talking about this tomorrow here at the Care Show. I think you're going to share the lessons and wisdom you've picked up about the government plans. Can you give us a bit of a sneak preview? This is going to go out after the Care Show, so you're not giving it away.
I think it's fair to say that the Labour government doesn't have a well-formed plan for social care. I don't see that as necessarily a bad thing. It would be worse to have a plan that nobody agreed with. So having an opportunity to influence is potentially positive, but at the moment we haven't heard anything tangible about how we can go about doing that. I've personally had 2 meetings with others, with the Minister for Care, Stephen Kinnock. The first was to tell us that they were cutting funding for training.
Yes, I remember it well.
Yes. But the second was an in-person roundtable. There were 14 leaders from different parts of the care sector, including people drawing on services. And he gave us an hour and a half, which was very good. So that meant that everybody had time to put their suggestions forward. He talked about the focus on employment rights, fair work, which is happening first in social care. We've had some further conversations since with the Department for Business and Trade, because they are leading on the employment rights legislation. As we understand it, the primary legislation will be laid this week, introduced, because they'd set themselves a goal of 100 days.
Yes.
100 days is the 12th of October, which is Sunday, not Saturday. So the word on the street is Thursday.
Right, interesting.
Lots of things are happening on Thursday. Skills for Care is releasing a workforce report as well. But as we understand it, the primary legislation is going to be fairly vague.
Right.
And the detail, yes. And that secondary legislation will take a fair bit of time. It's complicated because it involves all business sectors.
Right.
I think the officials are finding it quite challenging to draft it.
That could cover everything, yes.
Yeah. So there was a lot of conversations about that.
National Care Service, any further thoughts?
He talked about the National Care Service, how they want to create one, and having some national standards, and he invited suggestions for what those standards could be. I make the point that we already have a lot of standards. The problem is that none of them are enforced. But if he did want to think of a new one, then introducing a national contract for care services would be a good idea. So we've been advocating for years, as you know, for a minimum price for home care.
It's a fair price.
And if we had a minimum price agreed nationally for purchasing home care that no public body could go beneath, that would very much help the sustainability, but more importantly the workforce, because if we have 0-hour commissioning at low fee rates, we end up with 0-hour employment at low wage rates.
Yes.
Direct connection. So if you want to fix the wages, you've got to fix the commissioning, and the local authorities are not necessarily doing things the way they are because they want to. They're doing it because they have to balance their books, and they've had underfunding for years. Many providers now actually feel sorry for local authority commissioners because they've got an impossible task.
We've had the county council network figures around 54 billion for the next 5 years. So I guess that standard, a national floor, if you like, below which you can't go. Was it heard with some sympathy, or at least noted?
Looked surprised, and like it was something they hadn't thought about. I did float the idea at the Department for Business and Trade with the Director of Labour Market Enforcement, and their sort of attitude was, oh well no, the government couldn't possibly, legislate for something like that. Well, why not? If you're determined to fix the labour market, you need to do that.
Yes.
Because it's not ethical to, the point I made to the Minister was, if you council purchases Homecare for £15 an hour, they can't employ people on £15 an hour. It's basic.
Do that.
Yeah, do the maths.
It's not A-level maths.
No. So I feel there's quite a gap in understanding about very basic things. So
that's disappointing, isn't it?
Yeah, I mean, at the Department of Business and Trade, I've had to explain how the costs of home care are built up, because one of them said to me, like, what happens to all the money? If a citizen pays £25 an hour and the care worker gets £11.44, well, where does the rest of it go? Is that all profit? Well, no, there's something called statutory employment on costs. You've got to pay pension and national insurance and holiday pay and sick pay and average travel time and mileage, and our sums show that comes to an average of £19.90. Then you've got to contribute to the cost of the registered manager's salary and the other staff in the office and the IT and the telephony and renting the office in the first place, regulatory fees to the Care Quality Commission, yes, corporation tax, PPE, insurance.
As you say, the fact that there isn't a plan might be a good thing, because if we're not haven't got clarity about the basics, we've got to start from there.
I think their concern is that there isn't enough money to do it, and they don't want to promise that they can do something that they can't. And also, I think they're politically afraid of going there, because everybody who's tried in the past has come unstuck.
Or not tried at all.
Well, I mean, a lot of them have tried actually. Tony Blair, commissioned he did a royal commission, but then chose to ignore its recommendations. And then Theresa May tried.
Got pilloried for it.
Yes, and who else? David Cameron. He put in proposals for cap on care, but then care costs, and then sort of withdrew. Boris Johnson legislated for it, but delayed. And I think the Labour's first proposal, Andy Burnham, tried to introduce a national care service back in 2010 or something, and that was sort of dubbed a death tax. So, but I do feel that the society has got to the stage where so many people have got personal experience for a relative or a neighbour, or that it's becoming a very real live issue. And if you look at the House of Lords, many of them are sort of on the older end of the spectrum, and they are experiencing firsthand how challenging it is. So, and I think economically there's a strong argument, as we discussed on the previous podcast, because
the contribution
many people are not able to work because they're supporting loved ones. And Carers Trust recently released a report about young carers and how many of them are missing school because they're supporting people.
Someone maybe can do an econometric analysis of saying, actually, if you stop people having to have these caring responsibilities, how much could they contribute?
Yeah.
Well, let's see what the budget says. One very final question that I'm bound to ask, bearing in mind your report into the CQC. Now we've had a new appointment, Sir Julian Hartley, who's been a guest on Voices of Care. Just a couple of minutes on what your views and hopes are around that, because I think you were on record as saying that the way that the regulatory regime is operated in home care is a bit like a ship taking on water and buckets being used to empty it.
Yes. CQC has managed to get itself into a model, and it needs strong leadership to recover. They produced a so-called recovery plan last week, which isn't very detailed, hasn't got timelines or clear actions or responsibilities. Most people on commercial boards wouldn't get away with producing a report like that. So Sir Julian has got a lot of work, and I think that one of their biggest challenges is that they've lost a lot of good people. Some people actually have gone back to help out, I understand, so maybe with the right environment to work in, they will be able to get some people back. But I think that, one of the things I pointed to in my report was the fact that for whatever reason, the home care market has ended up becoming very fragmented.
Yes.
Councils have taken either a hands-off approach, or they've actively decided that small is beautiful and it's a good idea to have a myriad tiny providers. The problem with that is that there isn't enough resource available to monitor the quality of all of these providers.
Either 60% unrated or
yes,
not been rated for a long
yes,
time.
and that's bad for people drawing on services because no one is checking who is doing the right thing. Many councils haven't done proper contract quality monitoring for years, so we desperately need regulators to work. And it's not just the Care Quality Commission. The HMRC hasn't got enough resource to check on minimum wage compliance. And one of the things that Labour is going to do is introduce a Fair Work Agency. I think that will go live in April 26. And they asked me in the Department of Business and Trade what my views were about that. And I said, well, I actually think regulation is helpful if it's done in the right way. You need a level playing field.
Yes.
But what will be different about this regulatory body, because the others, the regulations are there, the standards are there, it's just that nobody's properly enforcing them. So if we have another regulator that isn't properly enforcing anything, how's that going to help? So what's going to be different? And they weren't able to answer that question.
So Julian, if you're listening, you've got a lot on your plate, and I'm sure Jane will be advocating, as she has done so brilliantly for so many years. Thank you for your time, your candour as always. I look forward to seeing you later on around the show and coming to hear you speak.
Brilliant. Thank you.
Pleasure. Thank you. Michelle, welcome back to Voices of Care of a buzzing NEC.
It really is, isn't it?
It's amazing. I've been here since
really
the morning
buzzing.
and it's just busy.
Yeah, and it's fantastic to see that so many people are clearly interested in care, and that's what we like.
And it's a transformative time
It
for
is.
care. 28 years plus for Newcross, and you are chairing or leading a panel here on a really, really important subject close to your heart: clinical excellence, compassion. Tell us a little bit about it. You can let us in because this is going to be filmed afterwards.
Okay, I was going to say, I'm giving you nuggets here that no one's heard yet.
No, that's fine.
Absolutely. So I was asked to present a piece and head a panel on clinical excellence.
Yep.
And which is a big topic.
Huge topic.
It's a huge topic, and it can be a little bit dry sometimes. So I looked at this, the whole sort of clinical excellence piece, and thought, okay, so what does it really mean to me? And it came to me very quickly and very easily: empathy.
Yep.
For me, empathy is the foundation of healthcare, and so the whole panel, the session is based on empathy in action. And it's also featuring some true stories with key individuals. So Claire Thomas, who's the registered manager for Ilford Park
Who
Care Home.
Newcross have known for so long.
We've known each other almost 28 years.
Wow,
So she was one of
wow.
our first customers, which is brilliant, and
Amazing.
still is today.
Amazing.
So I'm really proud of that.
Absolutely.
We've also got Colin, who is the father of one of our service users, Thomas, that we take care of in the community.
So we're bringing to life what it actually means, all these words that we hear as a parent.
As a parent, and I think he's going to steal the show. I think he's going to be absolutely brilliant. And then we've got our lovely Claire Reader, who's our VP of Community Care for Newcross. So we've got some really powerful speakers there, and we are really exploring together the whole impact of empathy, of how we treat our customers, our people. I hate the word service users, customers, because it doesn't really depict what we do.
It's the human connection, isn't it, we have to get back to?
Absolutely. So it's the people in our care, and I think for me, if I could sum up the impact of empathy, it's really quite simple. I think for a receiver of care, I think if you are delivered care with empathy, it's a difference from having things done to you to being taken care of.
And that goes to the essence, and you can speak to this as a clinician, of personalised care. Because it has to be the person.
Absolutely. It's the centre of everything. And, I've seen in my years of as a clinician and as a nurse leader, I've seen people treating, caring for people with empathy that's just wonderful to see. But sadly, I've seen it missing.
Have we lost a bit of that? Is that?
I think sometimes it can be lost when carers, when nurses, when healthcare professionals are really under pressure. And sometimes care does become very task orientated because things have to get done.
Yes.
And people believe sometimes that empathy takes time, and actually it doesn't.
It should be
It's a touch, it's a smile, it's just the way that you converse with someone, and that's part of delivering the treatment, etc. So I think it can be. I do think it can.
It's also, I guess, a function of the values you have as an individual and as a organisation. And I'm sort of going back to that very distinctive role that you have, Chief Ethical Officer. So it's a golden thread that goes back to values?
Most definitely, but this, for me, my role as Chief Ethical Officer, it's been a role that I've now had for just under 12 months.
Yep.
But when we started Newcross 28 plus years ago, the empathy was the foundation of our values and our ethos, and I was very strong in making sure that this was maintained throughout these 28 years. And I think it's something that allows us to strive for excellence instead of just getting the job done, and it's something that I'm really proud of, and we can always do better, and that's what we always strive to do. But I have a really wonderful position that I am front and centre of what we deliver as an organisation, both from an establishment point of view, so with our temporary staffing offer, but also with our community care as well. So I'm kind of in the centre. So I experience from all facets, all aspects, and I can influence with my passion for empathy how we operate, and that brings me a lot of joy.
No, absolutely, and it's quite important because the Care Show this year, its theme is collaborative approach to social care. So I guess what you're saying and what the panel will be discussing, because you're talking to a provider, you're talking to someone who uses the service, the parent of, that compassionate piece, that empathy piece actually should connect everybody, workforce, the people who use the service, and also the providers, and indeed the regulators.
Absolutely, it's something that, as you say, we need to be connected, and I think it's also I see here I've had a quick walk around, and we in Newcross are really developing advanced technology to enable us to deliver our services in a more efficient, effective, in a better way. But we are, again, the foundation of our technology is that within this evolution, that we again don't forget why we're here. We're here to deliver care, and that again encompasses empathy. And I look around here at the Care Show, and there is a lot of technology here. I think every year there gets more.
It's more. It's amazing. More and more. It's amazing.
It is amazing. Again, it's making sure that when we are developing technology, we don't forget the human, the people. And what makes healthcare so very special, again, is that contact and that human understanding. It's what drives through a personalised, centred approach.
And just going on a tangent slightly, because I know this was close to your heart as a clinician, as a nurse, driving that approach in terms of the training of the workforce that Newcross deploy, and that has now become a much larger mission with the creation of FuturU, and supporting our nation needs 540,000 new people in this sector the next 15 years. We cannot rely on international recruitment to fill that, but I know this was part of your vision for FuturU, to be able to help give us the workforce and health, workforce security for the country.
Yeah, absolutely. I think it's twofold really. So I do think it's irresponsible to depend upon overseas recruitment, and we've got to cultivate and grow our own, if you keep the cultivation theme there. But I think it's something, again, when we develop FuturU, going back to the person-centred approach to care, which is so important, it's a front and centre, is can empathy be taught? Because a lot of us, it's in our DNA. So can it be taught? Do I believe it can be taught? I believe that we can influence through education. I believe that we can influence through knowledge. And that's why when we created FuturU, we were very keen to make a difference with the way that we educate. So we have hundreds of courses, and we developed a suite of courses that are very scenario based. So again, people-centred is the heart of the courses. It's not the traditional way of learning, it's getting people to be in the moment.
So immersed,
Immersed in
experiential.
it.
Yeah.
Absolutely. And so I was super excited when we were given the opportunity with the government's objective to develop the skills of healthcare individuals from the very beginning. So on the entry into this wonderful sector and career. So we've developed the Adult Care Certificate Level 2, which is ready to be launched, but we've not developed the programme in a traditional way. It is very immersive, it's scenario based, and I think it brings home the reality of care and should, I believe, evoke emotion and evoke caring from the individuals that are undertaking the learning. So I'm super excited about this.
And I think that emotion, that connection, just to finish off, your panel is about that. I know your own story. I guess you're still carrying that banner from your aunt and looking after your late grandfather. So it's you must be very proud of the journey.
Yeah, absolutely, but it's not over yet. There's a lot more to do.
Absolutely. Well, look,
as always.
Thank you for finding the time to come and see us. Good luck at the panel, and we'll catch up later.
Thank you.
Thank you.
Thank you very much.
The social care workforce and its training has never been more important in the sector. I'm therefore delighted to welcome to Voice of Care here at the Care Show, Mark Story, Head of Learning Innovation at FuturU. Mark, welcome to Voices of Care.
Thank you, Sir Hale. Hello.
Hello, it's good to see you. Been a busy morning already for you. Been past
Very
the stand
busy.
a couple of times. Lots of people coming to see what FuturU are doing.
It's been really positive, the feedback that we've been getting, and yeah, it's always invigorating hearing from the people that use our products and services.
Now, for people who haven't yet met FuturU, just very quickly, its mission and vision, it's to transform the way people are trained in social care in that sector.
So that's exactly it. We think that we can use technology to drive down the cost of training, improve the quality. Our mission is to provide universal access to free health and social care education
For individuals.
and offer a wealth of value to organisations as well. And we believe that our approach to learning is unique and much more effective than you might find elsewhere.
And that's a story-based approach, is it not? Because the evidence suggests that learners tend to have more longevity and stickability, for want of a better word. Is that right?
So, with a name like Mark Story, I have to be delivering story-led learning.
Exactly. Yeah.
Yes, so we put the learner in a care situation. So rather than learn health and safety or duty of care in an abstract way, we want to put the learner into a care situation, which is what they will be doing, and bring all of that knowledge together, and we challenge them to navigate those situations, and then they learn by doing and progressing through those situations.
And I know you're very proud personally on behalf of the business that you and FuturU have been shortlisted for some very important awards for the work that you've done.
So there's 3 of our projects that have been shortlisted for the Excellence in Learning Design awards from the Learning Technologies, and yeah, we're massively proud of that, and it's a real endorsement of our approach.
And just before I focus on specifically on a couple of the things that you're looking at within social care, just taking the broad canvas, so it's over 100 courses, 90,000 active learners, and these are all CPD accredited courses?
So all CPD accredited courses, you're right, there's well over 100, 90,000 learners that we have on the platform, and a number of our courses are these real breakout, immersive, story-led, character-driven learning pieces. So you'll get to meet some really lovely, challenging but wonderful characters in our learning modules.
Now, let's focus on social care. The theme here at the Care Show is collaborative approach to social care. And now you know, of course, Skills for Care, groundbreaking workforce strategy for the adult social care sector only 3 months ago. And that's really needed, because I think the projections are we need 540,000, I'll say it again, 540,000 new workers in social care in the next 15 years. So that strategy and its recommendation around the level 2 adult social care certificate, I think is something that's really something that you're focusing on a lot in terms of the whole team.
We hope that this is the start of a really clear, progressive career pathway. And the level 2 adult social care certificate is a great start from Skills for Care to professionalise what I think is a really underrepresented sector. And all of the Voices of Care podcasts, if there was a theme, it would be that the sector is underrepresented, it's underfunded, it's under-resourced, all of the above. And we think this is one step towards changing the tide there. So we have invested heavily in the way that we prepare our learners who are going to be going through the level 2 adult social care certificate to go through a really engaging, immersive learning journey that again is this kind of scenario-based, story-led learning, which develops what my team is delightfully calling action intelligence.
Action intelligence, I like that. Yeah.
So carers develop a sense of what to do in a variety of situations and what they need to consider, and then we move them forward to an assessment. So we assess them in the workplace to make sure that they're actually really embedding and demonstrating that learning. So yeah, everything is great with the new care certificate. We just want to see more of it.
Yeah, and just very briefly, because the care certificate will be known to many of our viewers. It's been around. There's been a care certificate that's been around for some time, but this is different.
This is different. It's a regulated qualification.
Yep.
The previous care certificate is not a regulated qualification, so would be signed off by a manager. And while I'm sure that the majority of managers will be signing that off diligently, they're not trained assessors, so there will be subjectivity within that sign-off, which means that when you achieve the old care certificate,
there
will be a variability in there. And this new regulated qualification means that there is a single standard that all entrants to the care sector can achieve and demonstrate and be awarded a qualification for doing so.
Now, there was some uncertainty around the funding. I think that's a lot clearer. You're talking to who's this for? Is it for the larger, small, medium? Are you talking to a whole variety of providers, I think, across residential and home care?
Yeah, it's for all of the adult social care providers. What we'd like to see, and I'm sure that again in the Skills for Care strategy, looking at the career pathway, there needs to be a children's care certificate, a similar version for children. But at the moment it's adult social care providers, and it is big and small. So yeah, whoever you are, we welcome you to structure your onboarding in a really robust way by engaging with this new qualification.
And just one final point. I know you've got to get back to talking to the public. The broader vision for FuturU is really encompassing social care learning in its broadest sense and providing that support as a partner.
Yes, so we absolutely want to be at the forefront of learning in social care. And often people will equate online learning as being a cheap option. Mm-hmm. We think that we can do it in a way that increases the quality of it, the objectivity of it, and widens the access to it. So yeah, our mission of providing universal access to free health and social care education for the learners is really based on that premise.
And then one final element, because obviously the social care workforce strategy from Skills for Care talked about attraction, retention, etc., training. On the retention piece, I think FuturU has also invested in providing a suite of wellness modules that supports flourishing workers with their mental health, because that's quite a big issue across all of health and social care.
Yes, so there is a range of resources that we've got that support people's inner wellness. And when we talk about inner wellness, this is really about making sure that they're able to quieten those negative voices in their minds, get more of the emotions that they need. And if these people are delivering care to others, they firstly need to be making sure that they're caring for themselves. So it's hugely important. And if people access the platform and access the wellness content, I think that will engage them in the learning process. And the link between learning anything and mental health, I think, is well established. But the content here is unique in what's out in the market in terms of the way it's structured, the messages that it gives, and the activities that it encourages people to undertake.
And Skills for Care have been very open. They're welcoming new models of training and digitalisation. So I guess the timing is perfect for you and your colleagues and the team to keep pushing the boundaries.
I really hope so. I really hope so. I think we can not replace the practical skill element that is required in care, but I think we can edge closer towards it and prepare people more for the real experience that they're going to have in their care careers.
Well, it's a fantastic vision. Thanks for taking time out and joining us, and Mark Story, thanks for painting that picture.
Thank you.
Can we talk a little bit about, I know the themes around, we can't cover it all, of course, train and retain, attract and retain, train and transform. But in terms of some of the recommendations, some of the key ones that you have seen that have been really embraced by the sector.
Yeah, so I think probably the most important recommendation is pay, care worker pay. If we could fix that, we'd fix a whole load of things. That really is in the hands of the government. I mean, there is no money in the sector to be able to do that. So we're very much in the hands of the government. But we know that the Fair Pay Agreement is coming, so that's quite exciting. We're really keen to make sure that social care is at the top of the list there. So for me, I think some of the game-changing stuff really sits around what we've described as our small but mighty workforce, our regulated professionals, our social workers, our nurses, our OTs, and our registered managers. So we call them small but mighty because they make up a really small percentage of the workforce, the biggest percentage being our care staff. But those regulated professions and registered professions, we know where they are, we can reach them, and if we create the right environment, give them the right training and support, they make the biggest impact, they make the biggest difference, leadership, care assessments, all of those kind of things. So that for me are the biggest kind of game-changing areas. And then under transform, I think digitising, social care, there's so much going on there with the social care team in NHS England, the digitising social care team across DHSC, lots happening there, so much more that they want to do. So, that's going to change the sector, isn't it? It changes what we're able to do, changes how efficient we can be and how exciting we can be, and that we can be a career for younger people as well, excite younger people as well.
No, and I think you touched upon nursing as well in front of it, and that's still for some a bit counterintuitive. When you think of nurse, you think acute setting. But I think, again, my numbers may be slightly up, 34,000. There's a big number of nurses that play a core role in the sector.
Yeah, and we need more. We absolutely need more. And I think, aside from nurses and social workers, we really undervalue our OTs, our occupational therapists. We don't talk about them very often. They are quite a small group of people, but actually they can make so much difference. And we talked to areas while we were developing the strategy to find out where the kind of really sweet spots were happening across the country. And Kirklees and Calderdale now have an OT-led front door to their social services. They've saved millions, but they've also stopped people having to have unnecessary care packages by just using technology and equipment. So game-changing, our professionals.
Absolutely, and obviously the connection with the NHS can never be severed because the large number of people that need the care. Now, it's hard to believe, but the actual strategy came out 3 months ago. I know. It's been a whirlwind since.
I know.
Now, you guys haven't, obviously, knowing owner, etc., you haven't sat on your hands.
Oh, no.
I think September was Driving Social Care Change campaign. Tell us a bit about that.
Yeah, so at Skills for Care, we tend to have a different focused campaign every month or every couple of months.
Data this month, I think.
Data this month, technology, and we wanted to have a really strong kind of push of the workforce strategy. So September felt like a really great opportunity, 2 months on. And so we focused it around blogs, case studies, lots of being out there talking to people, lots of events, lots of kind of sharing recommendations and things like that from the strategy. We also kicked off in September a big kind of virtual event, regional. So we had lots of regional breakouts. We worked with care providers, integrated care systems, local authorities, and we really kind of got them together in a room and said, what does the workforce strategy mean for us in the Southwest or the Northwest? And so we got some really powerful conversations out of that, and we were able to take some of that through that campaign.
Fantastic. And obviously some of your recommendations, as you say, pay is going to be fundamental. We know that. and that is going to be dependent on the government. But there are other elements of the recommendation which you haven't waited for.
Yep.
I think that's the streamlining around some of the regulated qualifications. Can you tell us about that? Because that's quite a big change, even though it sounds quite technical.
It does. No, that's a big shift. So that was the sort of reviewing and revising of the mandatory and statutory training.
Which is quite a lot of suite of that.
Yeah. And that was a massive list before of what we described as core and mandatory training.
Yep.
It's a big, long list of training that needed to be updated regularly, and there is no legal basis for that list. So what we've done is we've reviewed the legal basis for statutory and mandatory training by its nature. If it's statutory or mandatory, you need to be doing it, your staff need to be doing it. But then we've said, and then the rest is open to you as an employer. What do you need for your service? What do the people that you're providing care and support for really need you to have? And that might be anything from nail care right the way through to being able to kind of deal with money or dementia training, specialist epilepsy training. You really then need to say, how do we tailor our training? What we don't want is for care providers to be bound by this kind of list of things that they think they've got to tick off because CQC are coming. We want them to be more imaginative and innovative with their training and really kind of go out there and find good training providers who will say, okay, we can do all the basic stuff for you, but then we've got this really exciting, using AI in your service or we've got these extra things. And you'll have the money to kind of buy those courses then.
So it's really to clarify the situation and focus people. And one of the areas I want to touch on as we close is there was a lot of press around this and an unprecedented letter from 30 social care leaders when there was all the uncertainty around funding.
Yep.
And this is the level 2 adult social care certificate.
Yep.
Much trailed. It's one of your key recommendations. Yep. Just how important is that? Because of we have to attract record numbers of carers into our sector.
We do, and you cannot ask someone to do a job that is so complex that care is. I think people underestimate how complex a job it is. You can't ask them to go in day one with nothing, and so the care certificate benchmarks that kind of, this is the basic training that you need to have to be able to go in and safely provide that kind of entry level care. And then you go from there, but the care certificate is absolutely the grounding that everybody needs. And it's so vital. And it's really great that we've got it as a qualification now.
Yep.
We just need people to start kind of buying into that and training providers delivering it to a really high standard, awarding organisations offering it, and care providers understanding how to access it.
And then one very final point, you talked about digital and the role of training providers is going to be fundamental. I know that Skills for Care are looking for what is best in class and reimagining training and digital. What are you seeing on the ground? What are your hopes? We can't even predict a year ahead nowadays with AI, but just be interesting to see with your 25 years of experience.
Well, and I ran a training company for 10 years.
Yes.
I had my own training company, and things, I have to say, haven't moved on massively since then. That was nearly 10 years ago. So there's something about, we want training providers to be bold.
Yep.
We want training providers to really get social care and to start thinking differently. Don't think about traditional same old training. Really start to think about, how do we engage with the sector? How do we offer them something different? How do we be bolder in our training? How do we get care staff excited about the job that they do and not just keep repeat the same old training over and over again? Such a complex job, and we really need to be opening digital training, using data better, how to use AI, what are these bits of kit that we can practice with, how can we engage with people differently, loads of new skills. Really excites me, and I think good training providers will be thinking about that now.
And just brought to mind actually one final point is was privileged enough to interview Professor Deborah Sturdy, who of course you know, and she actually painted the picture of the level 2 certificate as an entry point, going to your point about a career pathway.
Yeah.
People today who are thinking about or just started that could end up as nursing professionals in this. So
absolutely.
It is, so you can see that, you can see that vision.
Absolutely. And let's start to inspire our future nurses, our future leaders, our future registered managers, our future commissioners. Let's start to inspire them at care certificate level and get them thinking, this is a really great career and I've got so much opportunity. There will be lots of people that do the care certificate that think, I don't ever want to be anything else but a care worker, and there's no pressure on those people. But there'll be lots of people that think, I really want an exciting career, and they might step out of social care if they're not shown that. We might lose them. So let's start exciting people at care certificate level.
On that very positive and inspiring note, Jane Brightman, thank you for popping in, sharing your time, and I look forward to hearing your talk tomorrow.
Thank you.
Pleasure. Well, that brings us to the end of this very special episode of Voice of Care. I hope you've really enjoyed it. Some really insightful comments around what we expect from the government, how we can bring inclusion really to the centre of the workforce, and how the workforce strategy could transform this sector. Please join me for the next episode, and in the meantime, I'm Sahel Mirza. Thank you very much for joining us on Voices of Care.